Everybody to March Health in Hackney. I've had apologies for absence from the Adult Social Care Director, Helen Woodland. Everyone who's online can see who everyone else is, but in the chamber we're joined by Cllr Adams, Cllr Patrick. We're joined by Caroline Miller, who's the chair of the Conved. Welcome and thank you for joining us. And also we've got Joia De Sa, who's the public health consultant for the second item. So welcome and thank you. Just the basic matters of housekeeping. This is a hybrid meeting, obviously. We're being live streamed, we're being recorded. Sometimes members of the press watch on the catch up afterwards. If you're online, please keep yourself muted, but turn your microphone on, obviously, to speak. If it's your item, please keep your camera on. Please don't start conversations in the chat. And just to remind everyone in the chamber to please use the microphones, because otherwise the people online won't be able to hear you. And for those that don't know, it's the bottom right-hand button to do that. I haven't been notified of any declarations of interest, and I don't think there are any standard ones of those councillors that are present. And so to go on to our first of our three substantive items today on the agenda, we've got the Better Together projects. And so welcome to Krista Brown at Cllr Ferrigi from Volunteer Centre Hackney. So just for the councillors present, just to remind you, when we asked Cllr Kennedy for his cabinet members question time a few months ago, we were slightly rushed at the end of that for time constraint reasons, but what Cllr Kennedy was referring us to was this Better Together project, and actually handed out a helpful pamphlet on it, but we thought it would be a good idea to give it a little bit more time than we allowed previously. And so essentially there are 7 GP practices in Hackney that prescribe that can prescribe patients to the Better Together project, which is run by Volunteer Centre Hackney and has an array of different activities that you coordinate. So with that, shall I hand over? Is it Cllr, who would like to speak first? Is it Cllr first or Krista first? Who should we go to? Cllr first. So Cllr, over to you, please.
Hi, so Chris is going to do a presentation about what we do, and then any questions can come to me. I just want to say that we're in 8 GP surgeries, 1 in every PCN area of the borough, and in April we'll be expanding to another 8, so there'll be 2 in each area. So, and then Chris is going to tell you what we do, how we do it, and then any questions can come to me. Thank you.
Cllr and Krista, over to you.
Hi, there's supposed to be a presentation that's ready, a PowerPoint that should be ready for me to present to. We sent it in. We've
all got hard copies of it, and
yeah.
So you can. It's in people's packs, Krista. So if you just go through, say, page 1, 2, or what have you, want to do that, and then we'll know what you're talking to.
I haven't got it ready because I was under the impression it would be ready, presented via.
It's all right. Well, Jarlath is going to try and bring it up as we're speaking. Here we go. Cllr Kennedy. So there you go.
Could you go back to the first slide, please? I think is this the first slide, Cllr? Yeah. Okay. Is that the first slide? Yeah. Okay. So firstly, there's always a lot of confusion, and we hear this a lot, but it's not better. Cllr's laughing. It's not better together. It's together better. There's similar programs. You've got Better in Hackney. You've got some other health projects. So I think the names are bantered about, but often confused. But it is definitely together better. And it gives me great pleasure to be introducing the project to everybody. I've been working as one of the community developers on the project for 2.5 years coming up now. So it did start just before the pandemic, but then with the lockdown, everybody's priorities changed. So I was part of the new intake when it was resurrected as such post-pandemic at the beginning of January 2021. I'm based at Elsdale Street Surgery, which is in the Wells Street PCN. But obviously I know a lot because I've been part of the project since the beginning. I feel like I can speak confidently about the other surgeries as well. The surgeries you can see listed are the ones that are currently enrolled, plus Heron surgery, which is in the Woodbury Downs area. Is that what it comes under, Claire? The PCN, is that Woodbury Downs?
Woodbury Wetlands.
Woodbury Wetlands. So there's an additional one on there now, Heron as well. There's 7 of us in the team altogether, so it's not just me. I have 6 other colleagues. One of us does 2 surgeries, and Will, he does Lawson and Spring Hill. And the team is growing as well, which is always nice to see. The photos you see throughout this are real life from different activities that have been going on across the boroughs. So we could go on to the next slide, please. Okay, so we'll start with numbers because we know everybody likes statistics, and we recently presented this at an NHS summit, which summarises the project. So the statistics are quite recent, so probably to January this year. Claire, was it to January this year? So I think they've only increased, actually. None of the statistics have actually decreased. They've all increased since that time if we were to refresh this today. So we have, in volunteer numbers, 48 activities in total being delivered across these surgeries every week across Hackney. At the time, this was across 7 surgeries, so it's 8, as I said, the increase. 91 volunteers were active in January in the surgeries on that day, or in that timestamp that we took on that time. There's 1 community coordinator, like myself, in each surgery, and it's a 3-day-a-week role, so it's a part-time role. We all think it should be a 4-day-a-week role, I'm just saying. The busier the project get, we definitely could do with an extra day, definitely. There's 25 different activities. I think that's increased now to probably about 32. I was looking at something for the comms, and I think it's 32 different activities, which range from anything from a walking group to Tai Chi, to dancing, to cooking. We've got a lot of very specialist groups. So we've got like men's mental health support groups. We've got a lot of women's groups. Sewing and crochet and knitting seem to be like walking a commonality across every community, every demographic, every age group. So there's certain activities that kind of just bring everybody together. It doesn't matter what the background's from. We'd engaged at the time we did this, and this has definitely increased since January. So in a year from January 22 to when we timestamped this in January 23, we've engaged 437 participants. So that's active patients, and these are all patients. I should also add at this point as well that all the projects are led. I'd say 98% of the projects are led by patients across the surgeries. So the idea is that patients give back to other patients. They use their lived experience, and it improves their own mental health, which we'll see. If we can go on to the next slide, please. So a famous shot from our Jubilee. We had an amazing street party at Ellesdale, which was really nice. The mayor attended. It was really nice. Underneath, we have, I believe that's Groundworks, another local organisation working at Lower Clapton practice. So we have a lot of really good working relationships with people in the community, which is definitely important, I think, integral to the project running well. I think the relationships you build up in the local communities. The numbers there speak for themselves. I'm not going to go through every number because there's a lot of numbers. At the point we did that, we'd had 161 coffee mornings, 102 seated fitness classes. Our seated fitness instructor actually won one of the Mayor's Civic Awards this year for all the volunteering that he'd done. He volunteers across the borough at multiple surgeries and a care home. We've seen people that have come in as patients. They might have been isolated, depressed. They all seem to have some commonalities, definitely, when on the referrals. And they're now leading their own activities. So not only it's empowering them, it's giving them back confidence again. Some go on to start sort of longer term sustainable projects. Some people just stick with what they're doing with us. Some people have used what they've done and taken that onto other volunteering roles or even paid employment. So the turnaround you see in every little thing, like every walking group, every coffee morning, every activity, they really do count, and the friendships that are made in them are absolutely phenomenal. So if we can go on to the next slide, please. So the project impact. So this is probably the bit where I get sentimental, I think, where I get my job satisfaction, when you hear what the patients have to say, and you see the turnaround in the patients as well. It is absolutely remarkable. I know Cllr Kennedy is quite involved at the surgery that I'm based at, and he's seen it firsthand. And I feel really proud, I think, to have been part of seeing this community come back to life and become what it is. Friends, and I'll let you guys see the quotes because obviously you've got the hard copies. But to give you a little story, at my own surgery, there was 2 ladies, one's 87 and one's 78. No, sorry, 68. She'll kill me. Sorry, she's just been retired. Sorry, I'll just put 10 years on her. She'll swing for me tomorrow if I tell her that. Anyway, they both were very separate in lockdown. One of the ladies, 87, lovely, like old school East End lady, born and bred in Bethnal Green, lived here all her life. Stories for days, you know, like absolute legend from the East End. The other lady had actually been a doctor's receptionist for 40 years and had just retired. As she retired, so did her husband of 30 years, and he died within a month of their retirement. Within 2 months of that happening, pandemic hit her. So what she had planned for the next phase of her life, their retirement, absolutely went like overnight. She came in as a patient, isolated, depressed, or hadn't come out. She wanted to just get social, increase her social connectivity back again. She now befriends 2 other ladies, volunteers at a community lunch every Monday. She runs 2 activities for us at Ellsdale and attends absolutely everything. She has a social agenda that most people would die for now, if I had a fraction of it. Even better, the old lady and her found out that they lived on top of each other. So where they've been completely isolated for this whole pandemic, the friendship that has now formed, they go everywhere together. They're like a little duo. So when you see stuff like that, it's just, yeah, very, very empowering, very rewarding to see that. It's a remarkable journey the patients go on. So what do the surgery staff say? Because ultimately that's what we're there for. It's to reduce impacts of stuff and make things better for everybody all around, not just the patients, for the survey, for the surgeries, because obviously a lot of the ground level issues that patients have, they go and see their doctor because they're lonely all the time. They just want someone to talk to, or they might be struggling with the cost of living, or other things might be going on, and it's just that doctor is somebody solid that they feel like they can vent at and try and get some help. And we take a lot of that away and get them engaged in other stuff and distract their minds and make everything a bit more positive for people. So when we did this survey, 22 GPs and practice managers completed it from 3 surgeries. So it was only roughly half of the surgeries at the time. 75% of the staff survey said they had referred patients to us. 68% said it was easy. 100% of the staff said they feel that the project has benefited their patients. 100% of them said that it's had a positive impact on the surgery, and 100% of them said they would recommend this to other people. And that's how the project is growing, because the results speak for themselves. I think everyone can talk a talk, but the actions is ultimately what you deliver is what people are going to measure you by. And the project is always around in success. So to move on to the next slide, I'm not going to go through it. I've just given you a really nice success story. Another one that I definitely want to draw reference to at my own surgery was we had a lot of mental health crisis, and we were able to get the call from, so a patient attended a group, a suicidal thing was mentioned. It was reported to me. I reported it to the surgery and emergency. So we beat emergency services getting to the property. We could deal with it within I think it was 7 minutes, Claire. Was it something like 7 minutes or something? Really, like, it was mind-boggling how fast. I think the surgeries, the relationships we have with the surgeries are definitely key in the project working. And if you've got that good relationship, patients trust in you, and things like that are the success stories for us. And there's so many success stories that I'd be here till tomorrow talking about success stories. I think, is that on to the next slide, please? So that's it from me. I'm going to let Claire deal with all the important stuff now, and I hope you enjoyed the presentation. Please do come along and see it firsthand. Come to some of the surgeries and see it firsthand, is what I would say.
I think, yeah, what we don't mention in the PowerPoint is the relationship that our team builds with the surgery staff. So it's a really good relationship, makes the project a lot stronger. And also, we don't mention that a lot of the volunteering. So the surgeries give us volunteering opportunities for patients. 2 of the surgeries have actually employed our volunteers. They keep stealing our good volunteers, and employed them as reception staff at their surgeries. So the volunteers are going on to prove themselves and gaining employment from being in this program as well, which was not one of the aims, but there's plenty of very, very amazing, capable, skilled people out there that are volunteering, and they keep taking them from us and recruiting them in the surgery. So every program and every project we run, except for the walking groups and coffee mornings, even though volunteers help out, is peer-to-peer. It's led by somebody who is qualified within the community that's at that GP surgery. Dance teachers, art teachers, yoga teachers, they are all qualified instructors, and they're all happy to share their skill and a bit of their time to volunteer to give back to the patients. So every activity is us supporting a patient to deliver something back to patients.
Thanks both. That's fascinating, and it's wonderful to hear the work. And Krista, your sort of enthusiasm is infectious, so it's wonderful to hear. Just a couple of questions from me, then I'll throw it open. So those people, those patients that you've got coming, do you get the sense that they are genuinely representative of the different community groups that you're that the different surgeries represent? Because I mean, we constantly see this across both as counsellors and across health, that you sometimes get certain demographics or certain community groups that are harder to reach ones. How do you sort of, how do you feel that pans out, and is there any sort of data collected on that as to whether the number of people coming along to the activities are representative of the community? And then my second question is probably more towards you Cllr, just to get my head around the funding for this and its viability and its future. So you're now 8. If I've got it right, you're going to 2 practices per PCN, so you're going up to 16. So the funding for that, is that joint council NHS? What is your funding? How much certainty do you have of your funding commitment? Do you have to apply every year? Is it a 3-year programme? And so you just give us some overview of that, because clearly we're beginning to see the benefit of this, and obviously the question for a lot of us is, should this not be rolled out or available to all surgeries? So just with that in mind, those sort of questions.
Okay, so I'll start with the demographic background. I think ethnicity, we're reaching in communities, and we have certain groups like women's groups and stuff that is about people's, but I think age demographic is definitely 45 plus for us. Maybe it's because it's in the daytime when people are working, so there's less opportunity for them attending activities. We've always talked about surgeries, and now some of them are now open on a Saturday and a weekend, so maybe we can address that better in the future. So age demographics, definitely not reaching. We've definitely got a group of people from 45 to like 95 is most of our patients. But everything else we're reaching quite well, and it's all been really, really positive. In terms of funding, for the pilot, it was funded fully by the ICB for 2 years to pilot in 1 surgery each area, PCN. And now we're just creating contracts as we speak. We've been funded for another year, which is half of it's coming from the ICB and half is coming from the PCNs themselves. So they've recognised the positive impact we're having, and they're putting their hands in their pockets and paying towards it as well. So it's half funded, but it's only for another year.
And then can I just get that right then? So because of the half and half funding, presumably more for you to be able to double up, you're not being expected to do the same amount of work under the same with 2 surgeries. So presumably it's doubled up.
It's doubled up. So yes, so the ICB has doubled up. So there's going to be more management costs, more, and then the PCNs have doubled up. So we'll have recruit another staff member for each area. Yes.
And so presumably your challenge right now as a manager of this is over the next year is to retain the same standard you've achieved with that doubling up and bedding in that growth.
We actually think with having 2 staff members actually will be better, because each community development worker that we have, community engagement worker in each area, it can be quite isolating. You're on your own, your patients are referred to you, you're working alone. But with 2 in each area, we can share. Also, part of the funding agreement from the beginning was we couldn't take referrals from other surgeries. So there's lots of people in a PCN area that needs this support and would really benefit from this program. But from April, we can open up so we can take referrals from all patients. So we kind of are opening up to the whole borough. I mean, I still think it's going to be extremely busy being able to be referred from the whole PCN to 2 community development workers working at 3 days a week. But it's expanding in a positive way. There's been 2 staff members. Krista works really, really hard. I think it's just completely finding the right team and finding support for each other. So whereas people could attend activities at Krista's surgery, now they'll be able to attend activities at 2 surgeries in the area. And so other surgeries that are not got us based there can definitely refer patients to us. Whereas the surgeries that we are based at, we can take self-referrals because we assess them and do one-to-one support with them as well in the beginning. But we'll still take referrals from every surgery in each PCN. Perfect.
And Krista, you've got your hand up.
I was just going to intercept. In my particular surgery, I do get, I'd say that 15%, 10-15% of referrals are from 2 other surgeries in my PCN. Predominantly 10% coming from one, and a couple filtering through from another one. But that's more because I have a really good relationship with the social prescribers. They're based in the same PCN. So it's a built on trust relationship, and they know that their people will get looked after. I'm quite looking forward, and I'm hoping a particular surgery becomes the next part of our PCN, because then it means we're literally covering both ends of the PCN, which for accessibility for patients just opens up the project even wider. Also with the demographic thing, I was just going to say, we celebrated International Women's Day last week, and we had 11 different nationalities around the table, and they all brought food. So it's very, very much Ellesdale, definitely. I mean, Mr. Kennedy will tell you, Chris will tell you, very diverse. We did a big Black History Month piece there as well. So diversity is definitely celebrated. All types of diversity is definitely celebrated, whether it's through the volunteers or through the participants that attend the projects, like across the board, I think. And that's something that we're all really proud of, I think.
Wonderful. Right, I've got questions. So I saw Cllr Adams first, then I'll come to Cllr Adebayo, and then I'll bring Cllr Kennedy in. So Cllr Adams.
Thank you, Chair. Thank you for the presentation. My question is very simple. I just want to, as a matter of interest, I want to know, how did you pick the surgery that's participating in this project? And again, is it, apart from referral, do you advertise the local community to be part of the project?
So sorry, I only heard the first part of the question. We didn't actually pick the surgeries.
The second part is, apart from referral from the surgeries or something like that, or from the GPs to participate in the project, did you actually advertise to the local community to let them know the kind of service you are providing?
So, okay, I can answer both now. So the first part is, we didn't pick the surgeries. It was really based on what surgery has space to deliver this activity. So each area was told about it. Each PCN was told about this program, and would they like to host the pilot, and the surgeries that had the space for this program, because we need space to run activities. We need space to have yoga classes and art classes within a surgery, because people feel very connected to their GP surgery and they're safe. And because we're targeting patients that are slightly isolated and not get out much, we really needed to be based where they would go and they would be safe. And that is a big part of this program. So the surgeries we've been put in have been surgeries that do have the space to facilitate this program. And then the second round of surgeries are being picked by the PCN themselves. So they will discuss it between them and choose what surgery. We don't pick what surgery we go to. We can do what we do anywhere. We'll try to anyway. And the second part was, in terms of the community, we really held back at advertising and letting the community know and inviting them in, because the terms of our contract was only working with patients from that surgery. And that was one of the funding criteria. But now that we're PCN wide, more than likely everybody in the area would go to a surgery in the whole of Hackney. So we can advertise more to the community and invite people in. Yes. We've just started putting banners up outside the surgeries now. So anyone can contact us now, because we're opening up in April to everybody.
Cllr Adebayo.
Oh, thank you, Claire, because I was just about to ask whether you have any waiting list. But from what you've just explained, I'm not sure whether you have any waiting list. And on top of that, is there any time constraint on the length of a session someone can attend?
So no, if someone wants to attend every session that we have, they can. It's about their time. It's them feeling included and feeling listened to. A lot of our work is definitely the relationship building we build with the patients. So we've been able to be part of the neighbourhoods program as well, where we feed information back from the patients, because we are building really strong relationships with them, and they really do open up and tell us about all of their health and wellbeing concerns from the whole of their life. So we feed all this information back to Healthwatch now, and the neighbourhoods program we're also partnering with. So all the information we're getting from these patients is going to be fed back into the system. We've never had a waiting list. Some rooms are getting a bit tight. I'd say Ellesdale, a coffee morning it's a bit tight. There's a lot of people in there. It's hard to squeeze everybody in, but everybody's welcome, and we've never had to refuse anybody. It's more about the time it takes us to encourage them to come along. So that's what we work on.
And Cllr Kennedy.
Thank you, Chair. You rightly raised the question of funding, and on many occasions and in many places, I've gone on about how the system at all levels acknowledges that we need to move to being a system that does more prevention and is less a national sickness service and more a national wellness service. And you do that by getting in there with prevention first. And you'll have heard me talk about Henry's famous top slice from Nell in another meeting with people who are talking about cultural prescribing and cultural activities that can help people stay well and keep them out of health services. I heard someone talking about it as a 1% shift to the left, where you take 1% of what the whole Nell system gets and you put that into PINs, into prevention, and then you start being able to fund things like Together Better for maybe 5 years, which might be 3 years plus 1 year plus 1 year. And at the end of 3 years, you do a really good data insight and you say, okay, well, you're not quite reaching all the people we wanted you to meet, and perhaps another organisation has some of the funding, and you have to cut your cloth based on the data and what that's showing you. You know, perhaps other organisations would be better placed to meet those working age populations and provide them with some after work activities that might help their mental health and keep them out of primary and secondary care. But the system has to fund it in order to be able to do it. And that's very much one of the things that we're looking at across the piece. And when you start running out of space for your coffee morning in your GP surgery, that's when integration comes in, and the local authority says, oh, we've got a community hall down the street, you can have your coffee morning there, or you can have 2 coffee mornings. And that's when an ICS, an integrated care system, really starts to work.
I completely agree with you, and we're always banging on about empty community spaces that could be really useful for these programs. When we're doing seated exercise, for example, we can only fit 10 in at a time because they come in wheelchairs or they need disabled access. And lots of surgeries do not have disability access, or they give us space on the 2nd floor, and it's because it's all they have. They're still giving us space, but space is always going to be a challenge in the whole of the borough, actually, in terms of these activities. We can only limit ourselves to the space available within a surgery and whatever a patient comes up with.
Thank you. I've got other people wanting to come in. Just a couple of things. One, just on that point, Councillor Kennedy, I don't think we do we, as a council yet, on our website, have a sort of like a map of the borough showing where all the community spaces are and like who the contact point is. And so, do you see what I mean? I mean, I'm just, as you were speaking there, I thought that would be a very useful resource for a whole host of different community groups. I don't know whether that.
We've just launched, haven't we, our all-wizzy book a community hall for all the community halls that are Hackney housing has literally just been launched. But the price of those and have you done your what's it called, your risk assessment for your organisation are then the kind of things that start tripping people up. So we haven't quite joined it all up, but we know we need to.
And then the other point I was thinking as we were having this conversation, which actually occurred to me when we were looking at the evidence base, is of course you and I was informing other members before, we got informed by Zienau, the head of the ICS, about, although the budget is standing still for this year, but it's not really because of inflation, the following years is going to be an expectation apparently of a 30% spending cut going forward for the next 2 years. And then the concern could be, certainly when I read that some of the matters we're talking about today might be the easiest in some ways to cut back upon when you're met with several secondary sort of tier pressures. And so where I was getting at, what I was thinking of, is just sort of saying to Claire and Krista, and maybe even to you, Councillor Kennedy, is are we properly supporting them in evidencing the work that they do, so that if it does come in a year's time to sort of very difficult financial decisions, that there is a very clearly robust evidence base to be put forward as to the value of this work. And so I don't quite know whether, because the presentation was great with lots of qualitative feedback, I suspect some in the NHS might want to see data and stats there, and non-relapses and things like that. And so I just query whether, for your own success and going forward, whether you need to really have that ready to go for future funding and your future sort of success. But that was just an observation I had. I don't know.
No, absolutely, and we are working on that this year, actually. Again, it involves more input from the surgeries, because we don't have access to their databases, and we kind of don't want access to their databases, because it means that we have to input information, and it's too time consuming for us. We'd rather spend our time with the patients. But what we are doing this year is we're really trying to assess frequent attenders, which is it has a big impact on surgeries. So 13% of surgeries have frequent attenders that attend regularly for maybe not health reasons that they need to see a GP. So if they are referred to us, we can monitor if they're attending less times, booking less appointments, if they are their medications lower, if they go into one of our fitness activities, whether their diet, with their blood pressure is lowered and stuff like that. So we are trying to monitor the physical health impacts on patients and the time it spends when they go into the surgery. So that is something we're planning to do this year. But again, that's a lot more input from a GP practice manager. Usually they have to sit there and go through all the data with us. So yes, we're trying to gather that evidence this time.
We did when we were doing the survey last year. Do you remember, for the data for the NHS? And we did do, I know that I did it at Elsdale. I went through it with the deputy practice manager. So we have done it. I think we're now finding a way to record it in an informed manner. So, but it has been done, and there was definitely, I think it was like 89% or something when we did remember you did the presentation ages ago, Claire, and I think it was like 89% or something like that of the 3 surveys that had checked their data at the time had seen an improvement, you know, like within their patients' attendance, like Claire was saying, the frequent attenders and stuff. So we did do a sweep on it for the NHS at one point, yeah.
Great. And Krista, do you want to come back in before I've got Councillor Patrick and Cllr Turbet-Delof as well?
Yes, because it was in relation to the 30% figure that you quoted, and we don't want to set any hairs running.
Or 13%.
No,
I think he was quoting me. He was quoting me, quoting Zienau.
And it is 30, but it's 30 around Zienau support staff and the support structures for the whole system, not the 4 billion. So the 4 billion that goes into the whole NEL health service is not being cut by 30%.
Thank you for clarifying that. That was my hairs were running because I didn't misunderstand that. I clearly read Zienau's message too quickly. Thank you, Chris. So can I then bring in Councillor Patrick next, please?
Yeah, what I've seen and heard, this looks like a fantastic scheme. I just wondered whether you knew which practices it was going to be extended to, and whether it could be extended again. I know Chris has said, because that's what I was going to ask, why aren't we using our community halls that most of us sit there empty during the day? I was thinking about my own practice and the fact that there is a council community hall across the road, but it's probably empty most of the day. And on Kingsbury, where there's a practice, it's not one of these, there's an empty community hall sitting there during the day. I really think we need to move into those community halls. They are sitting there empty most of the while during the day. I'm glad to hear that it's working well. And also, I'm not sure I realise how people are being referred. People being referred, and is there reluctance for some people? I understand that once they are in the scheme, they find it brilliant. and how people find out about it. I'm glad you're putting banners out. It's going to the community. But there are, I know, just talking from my own world, there's some very vulnerable people with health needs, and there's nothing down there for them at the moment. This looks like a great scheme that's got to be rolled out down to Kingsway.
So we're actually running another program. Volunteer Centre Hackney has another program called Our Place that's actually just moved into the Kingsmead and is doing the People and Places program for the next 6 months. And we are in contact with Kingsmead GP surgery, but we don't pick what surgeries they attend. We attend, they do, and it does depend on what surgery has the capacity to have us. And also there's no money in any budgets for hiring spaces, which has been the option so far. So there is community spaces and we can hire them, but we don't have the money in our budget to hire a space to run an activity. And on another note, it is a slight concern because a lot of the patients that do come to us do feel safe at their GP surgery. So asking them to attend another location that they've never been to, which would be probably fine after they've spent some time with us and got to know, and if we relocated a coffee morning, but in the beginning, getting them to come to the GP surgery because their GP has told them to, or the social prescriber has asked them to attend, it gives them a way in and they feel comfortable, and then they'll go out to dinner like they are tomorrow night, for example. But they really like the safe space of a surgery, which they know in the beginning, and it does help us. And we take referrals from anybody, and also patients can self-refer, so they can just call us from the number on the banner or the leaflets that are in the surgeries. So we take referrals from GPs and any staff in the GP practice, but we also take self-referrals, so people can just call up and come along. Anyone can.
And just on the point of not having the budget, can we, is there, in terms of the charges that we level on the community halls, is there any way to, and forgive me if this has already been done, but is there any way to work a way through that for this project and or other health related projects we don't charge?
I think this is a wider conversation that has to feed into the whole review that's going on at the moment that Stephen Haynes is leading of how we use council assets.
Okay, all right, but it may be something we can. I know there are many different elements to that, but you know, it may be something we can consider feeding back. Cllr Turbet-Delof.
Thank you, Chair. Thank you very much, Krista and Claire. It's a quite inspiring report. I've had the luck actually of attending one of the sessions and seeing it myself, and one of the very profound, I think, feedback that I heard a resident saying is that these projects save their lives. And my question out to both of them is, yes, this is successful. Can we look at expansion? I'm really pleased to hear that we're talking about the community groups or the halls that are sitting empty around Hackney, and great that it's being launched on how to book it better. But can we hear perhaps from Krista and Claire for them to elaborate on the challenges also that they can see perhaps upcoming, so that we hear that from them. They have already touched on some of them, but I would like to see if there are any more that we need to know as a council, so then this sort of program doesn't stop. Because there is, for me, in my experience as a volunteer for nearly 20 years, it is a phenomenal program and it really does work. So congratulations to all the work that they do. But can we hear about maybe more challenges that we need to be aware of? Thank you.
So I think it's sounding very underwater. I apologise. I think he was asking about challenges that we're facing.
What are the more challenges in terms of you're doing great work, but what's the more challenges? What's on your risk register going forward?
Well, obviously, mental health is extremely high in Hackney. I mean, we didn't even realise until we are community development workers, so we work with the community, so we work with everybody. But for us, not being clinically trained, working with low level and sometimes medium to high level mental health patients is very high, and the cost of living crisis has affected people in so many ways that health and well-being is so broad now that people are coming to us about housing concerns, and it does affect their health. And like the landlords, legal advice. I mean, you name it, they come to us asking us to help them. Benefits advice. They are having problems with the systems online, so our staff is supporting patients to signpost them. We're supposed to signpost them to other organisations, but we get people like Krista that does it for them and helps them to do stuff like this. So I think they're coming to us with all of the challenges that they're facing in life. It's not just their health, but it does affect their health. And we are trying to address them. We would really like information, advice and guidance officers to work with us as well, so we can like bring that support along as well. So it also lighten the load on our team, because ours is about relationship building. Another challenge is, I think, for example, Krista spent 13 weeks calling someone every week, inviting them to the walking group, and they was like, no, maybe next week, but it took 13 weeks and it took 13 phone calls. So we don't give up either. We'll keep trying to encourage them and maybe find the right activity for them to come to. And even if they don't attend, sometimes they just like to know that we have thought about them and we've called them, because sometimes we're the only person they've spoke to in months. So yes, so there is challenges like that. Is sometimes people don't want to come out and they just really want someone to talk to, but we can't do that for everyone.
Councillor Adebayo, is that a legacy hand? Was that a further question?
Just a quick one. Thank you for the wonderful service that you people are providing within Hackney. And I was just with another mindset, because those who are in employment are already being deprived from this wonderful service. I put my hand up. I like to attend the sewing class, but I can't, because it's not within the working, it's not a design for those who are working. So it would be nice, because when we talk about preventative measure, this is exactly what you are providing. A lot of working class groups are going through a lot of mental health. They have no one to talk to, and coming out to join this particular service, or will be of tremendous help in enhancing their mental health. Is there any plan to extend?
Yes, Grace, we have a sewing class on a Tuesday evening that you are welcome to attend.
In Stamford Hill, on my other side. You're more than welcome to attend. It's actually tailored for working people. I run our place, in fairness, even though we're not talking about that project tonight, our place is very similar owners. It's resident focused as opposed to patient focused. It is financed by housing people as opposed to NHS people, but the ethos of the programme is very similar, volunteer-led, localised activities. So you can also find me on the Stamford Hill estate if any of you are up there. Grace, you're more than welcome to come along to my sewing sessions. Lois would welcome you with open arms. Feel free to contact me. To add on to what Claire said, because we're the ones that are out that deal with patients when they first get referred to us, and I call it Claire, I used to get told off all the time, stop doing so much work for them, it's not part of what we have to do. But what happens is, when patients come to us, they just want to vent. At this point, they've got so much stuff going on, it's just they're just going to tell anyone that's going to help them. So I know most of you probably know about Maslow's hierarchy of needs. I swear by it at work, and I call it the Maslow tier 1 stuff. It's the bottom level stuff. So unless you actually take that time to sit down with them for half an hour sometimes, maybe, hopefully not too much more than that, sometimes 13 weeks, as Claire just said. But yeah, you sit that hour, I can signpost to the right people if I know what the problems are. If I'm just another person, oh, come along to a walking group, people that haven't got food in their fridge, or they haven't got gas at home, or they've got mold dripping off their walls, or they're in rental arrears, whatever it might be, whatever their mental health crisis in that moment, whatever it might be, they're not going to worry about coming to a walking group. That's the last of their priorities, like making new friends. That's a couple of tiers up on Maslow. We have to get the fundamentals right first and get things in place. And a lot of it is a trust building relationship as well, I think, and doing things, because people often when we get them, I think people see them as we'll refer them to that and hopefully they can do something with them. So I would like to say that there's a lot of people that are in very high paid NHS jobs and we are doing their work. I just like to say that as a sweeping comment.
I'm going to tell Krista not to say that. They're our funders.
It's great. It's good to hear from. We often hear from NHS managers, and so it's good to hear from people who are actually at the very coalface and the bottom, dealing with patients. So it's great to hear. I'm going to wrap up this item now. Thank you both very much. I mean, I think it may be something in a year or so's time. It would be good just to get an update on how the sort of expansion side of it's going, the challenges question, where you are in terms of sort of funding spaces, using different facilities, those sort of areas. So if we can maybe schedule in a year or so's time to possibly have you back. Again, and just to reiterate, I mean, we see several groups and organisations before us as councillors. I think one thing you come to realise is that sometimes when you just get the right people doing the right thing at the right time, it makes a massive difference. And clearly, we're very lucky to have both of you who are doing this and making this work. So thank you so much.
Thank you for having us. And we will come back every month if you like, if it's the right people at the right time. We can pop back every month.
We do a lot of things for a free hall space. So thank you very much.
You'll be amazed at what
Thank
we'll
you
do.
for the invite. Thank you for the invite. It's been really nice.
Wonderful to hear.
Thank you
very
for having
much.
us.
Thank
you. So I'm going to move on now to the next substantive item on the agenda. Thank you, Councillor Kennedy, for doing the sharing the slides there. So the next item is a health and wellbeing strategy from 22 to 26. We're joined online by Dr. Sandra Husbands, our Director of Public Health, and also in the chamber by Joia De Sa, who's a consultant in public health for Hackney. Thank you for coming in. Thank you for your work on this. Sandra, are you going to start off and then?
Yes. Thank you, Councillor Hayhouse. I'll just do a brief introduction, and you may remember that we brought a paper about the health and wellbeing strategy to the committee some time ago to set out what priorities had been agreed by the Health and Wellbeing Board, and excuse me, and Joia, who's a new consultant with us, she's just been here a few months, working in the Population Health Hub, is going to present the work that the Hub has been doing on developing the implementation plan, focusing particularly on two of the strategy objectives. So I'm going to hand over to Joia here. Thanks.
Thanks very much. Hi everyone. So as Sandra mentioned, my name is Joia De Sa. I'm a consultant in public health, and I also co-lead something called the Population Health Hub. And what we do in the Population Health Hub is we try and work across the system to help partners understand their role in population health. And I've spoken with Jarlath, and we'd be happy to come and present a little bit more about ourselves and the work we do at a future Scrutiny committee. But to give you an example, we were involved in convening the Health Inequality Summit that Krista made reference to, and that was Councillor Kennedy was there, and that was a really wonderful example of a wonderful evening where lots of people came together to give examples of the work they're doing on health inequalities around the system, and then think about how we can take things forward. And if you thought Krista's enthusiasm was infectious on screen, imagine what she's like in person. It was really something to behold. So the Population Health Hub has been tasked with taking forward the health and wellbeing strategy. So in this presentation, I'll just kind of remind you of what was in the health and wellbeing strategy, and then give you some more information about the priority areas. Many of the themes we heard in coming through from Krista and Claire's presentation. So just a reminder, the Hackney Health and Wellbeing Board works together to improve the health and wellbeing of people in Hackney and reduce health inequalities. And there's a broad membership of the board designed really to think about how we can work together in partnership to improve people's health and well-being. So the membership's listed there. And the strategy really outlines the priority areas and how we'd like to work together to improve people's health and reduce the health inequalities. And this discussion is about the Hackney strategy. There is a separate city health and wellbeing strategy. So you'll have seen this before, but the progress to reach the priorities was a review of population health needs and mapping of existing strategies and plans, a workshop with the King's Fund, then engagement. So there was extensive resident engagement through a survey and then peer research and stakeholder workshops, and then a prioritisation workshop and then consultation on the priorities. And this really lays out the timeline. So the strategy was signed off in March, and then we've been working on what taking forward the actions from that looks like. So a reminder of the priorities. So the first is improving mental health. The second is increasing social connection. The third is supporting greater financial security. And really there's an emphasis on the ways of working to achieve this. So focusing on a community-centred approach, strengthening our communities, creating, supporting and working with volunteer and peer roles, collaborations and partnerships, and making the best use of community resources. So the first priority was around improving mental health, and I'll just lay out what came back from that resident and stakeholder engagement, and then talk to you about how that's being taken forward. So around mental health, there was a lot of focus on mental health services, greater availability, improvements, training. We've just heard about, community level providers on the front line are really experiencing that they're having to provide mental health support and know how and where to signpost people to get the right support, which is not something that perhaps they were expecting to do. Thinking about social activities, so how can you really get in on that prevention aspect. So thinking, we know physical and mental health is very well connected. Education, so education in schools more widely, again, thinking about prevention. Engagement with lots of different types of groups. Some suggested partnerships there, community support, funding comes up there. And then relation to other things that we know are stressors, so people's housing, people's family situations, and then communication obviously is really important. And these are some groups that the residents and stakeholders felt that we should focus on. So I'm not going to lay them all, I'm not going to say them all, but they're there for you to look at on the screen. And you may also have some views about this. So how we're taking this forward, mental health is a really huge priority across the system, and there's quite a few existing strategic documents. And what I wanted to emphasise actually at the start about the health and wellbeing strategy and the partnership is really the emphasis is not on creating or duplicating structures that already exist, but how can we really leverage the partnership and collaboration that we can bring across the Health and Wellbeing Board organisations to sort of inject more, to really inform and inject more energy into what is currently existing, and also highlight where there are gaps that we can feed in, for example, on the resident and peer engagement, what we've learned, resident and stakeholder engagement. So we've got the North East London Health and Care Partnership Integrated Care Strategy, the interim one, which has just come out, which includes mental health as one of the 4 system priorities. We have an existing City and Hackney mental health strategy, and currently the public health team is undertaking the scoping of a mental health needs assessment, which is really our public health approach to sort of starting again a refresh of what do we know about our population, what are the needs, how are we addressing these, where are the gaps, and that forms part of our joint strategic needs assessment. So the proposal is to write these findings into a strategic action plan that will include a sort of a gap analysis, as well as understanding where the strengths, weaknesses, opportunities and threats are of this partnership approach, reflecting the explicit focus of the health and wellbeing strategy, of improving health and reducing health inequalities, and that focus on prevention and early intervention. And this would be overseen by the Mental Health Integration Committee, which again has membership from across the part of the system, and we as a Population Health Hub would join that to make sure that we're
Committee sits at Hackney level or at Zienau level?
At Hackney level. There is also a representative from City on there, and that would be tasked with oversight of this strategic action plan. So we can discuss that in more detail, but that was just the sort of oversight of where we are at the moment on mental health. Increasing social connection. So really, I think this is so key, and it's the work stream that I'm taking forward. So what we've heard is important. A lot of it has come out through what Krista and Cllr presented on Together Better. But you know, what are the social activities and what are the opportunities that are available to our residents? Where do we need to engage? How can we interface with health and health services? Together Better is a really nice example of that. Communication, education and outreach. So which groups do we really need to be reaching? So I think that question around, are we really reaching everyone through Together Better? Where do we need to be looking? And that's part of what we'll be looking at through the action plan that we'll be taking forward. Again, those stresses that we already talked about, housing, employment, financial support, and food poverty is a really important aspect here, but also one that, you know, is an opportunity where people are convening and coming together. So again, these are the groups that residents and stakeholders felt we should be focusing on. And in terms of how we're taking this forward, so this is an example of where we didn't feel there was an adequate structure. So we are convening a social connections group, which will be co-chaired kindly by Cllr Kennedy and myself. We have asked each health and wellbeing board organisation to nominate a social connection champion, and then we'll bring in representatives from across the place-based partnership, so including City of London, because this is obviously an issue affecting them as well. As appropriate. And there was a social connections action plan, so I've shared the terms of reference for the group and also the action plan with you in the papers, and this was drafted following a workshop last year with membership from across the system. So the themes in that are raising awareness in communities, raising awareness amongst professionals, creating environments for social connection, monitoring levels of social connection. But I think there's scope also, as Cllr Kennedy was talking about, is we don't have any funding for this at the moment, but how can we sort of think more creatively about what we can do, and how we can increase focus in this area, sort of making it, you know, giving it almost parity of esteem with other areas that are considered important. Finally, priority 3, so actually you're going to hear a lot more about this in the next item, because that's where we are interfacing in terms of how we're taking this forward. But again, what we've heard is important. You will know much of this, so I'm not going to go over it, but it's there in terms of what the residents have expressed, and again, the groups that people felt should be focused on. But I think as the experience is showing, that there's no group that's left untouched by the cost of living crisis, really. So how we're taking this forward is the system-wide group that's been established, that you're going to hear about more in the next item. This meets monthly to ensure that there's a aligned cross-organisation response to the cost of living crisis. And obviously the group was convened to think about how you meet the immediate crisis, but there is a focus on going forward increasing financial security, which is the theme, how this theme is named. So we as the Population Health Hub support the administration of the meeting, and we attend as a member to make sure that we're feeding in the insight from the health and wellbeing strategy. And there's a programme overview, there's lots of different activities ongoing, but I don't want to sort of steal from what Nina's about to present. But yeah, that's all I was going to speak to quickly. I'm happy to take any questions. Thank you.
Thank you. That was really a thought-provoking presentation. Thank you very much. I've got, so can I start with, that sort of explained to me as to why sort of in the pack there were sort of like 2 in particular presentations on the connection side of it, and that was because essentially you felt there was a greater gap there. So just the overview of then where we are as a borough then in terms of service delivery of connection, providing that second limb of connection at the moment.
that we obviously have something like the Together Better project. We've got prescribers at PCN level, linked into both of those. There may be things like exercise classes provided by the sports halls. But is that, and then presumably what you're trying to encourage and think about how other agents in the council system can encourage or link into that? Is that sort of, as an overview, where we're at?
Yeah, I think I'm really keen that we do some really clear thinking about what are we defining as social connection? How do we want to maximise that for our residents? That was a challenge we got from the policy and strategy team, actually, which I think is a really useful one. So yes, there's an element of kind of service mapping, but also where are the gaps of where could we be really maximising this for all of our residents? We are exploring some research, some opportunities to link into research with consortia who are looking at this, and the opportunity to then benefit from the kinds of thinking that they're doing, so that we're kind of on they're on the forefront of thinking about all of this, so we can benefit from their innovative thinking around this and thinking about it in different dimensions, because I think there are things about, yes, you can be having the interaction, but what kind of quality of interaction is it? How frequent is it? Those kinds of different dimensions that perhaps we need to think about as well. Does that answer your question?
And then is there much of a sort of legacy from that sort of, this was before your time, before I think it was in the million, the lottery funding money that sort of that came in. I think it
was that for Connect Hackney? Yes, that's right.
I mean, at that time, that was sort of told to us as being something that wasn't just meant to be providing the service delivery there and then, but was trying to create something for the future that was sustainable. I mean, are you seeing much of that, or is there not much of a legacy to be crude about? Is there not much of a legacy there? Or what's your observations there?
I think, to be honest, I feel like it's early days for me to be able to comment on that. And Sandra, I think, has her hand up, so she may want to come in. It feels like that's a piece of work that people know about, and there is a legacy there. But in terms of what that's left, in terms of the kind of service mapping and those other bits that you were talking about, I think from what we've heard, every meeting I go to, I'm writing things down because I'm hearing about different projects that I think either have potential to link in with the social connections agenda, or Together Better. Much of the work the volunteer Centre Hackney does really addresses this side. They have a befriending project around social isolation. But I think we need to be clear about what we're addressing in terms of social connection. I think Sandra, do you want to come in?
Yeah, thank you. I really wanted to build on that, actually, because I think that's it's a very important question you've asked, and most of what we've done to date has been very much focused on service delivery. But actually, if we want to engender a lasting social connection not just between individuals, but across communities, so that we're really building social capital and creating the opportunity for healthier communities, and not just addressing immediate need, which is what the service provision approach does, then we need to do things that are much more creative, as Joia was saying. And so tapping into that research, understanding fully what our role would be in helping to build social capital among communities, and how that isn't only about, it will probably require some resources, but it isn't only about providing a service like Together Better or a befriending service, because for the most part those interventions at an individual level are time limited, but they are about individuals or small groups and not about whole communities. So it's a rather ambitious strategic objective for us, but I think it's really important if we're in the business of creating health and not just addressing ill health. And if we really want to reduce health inequalities, then we need to be able to support the building of that social capital within discrete communities and also between communities in Hackney.
Can you just explain to me in sort of, that's the conceptual thing, in in reality, how would that manifest itself? So how would what you just talked about it's not about our health, but community connected. What would that look like as an example of an end product?
Yeah, so it will, yeah, it's a little bit difficult to describe, and it's much, which is why it's easier to sort of theorize about, but it's, what you see then is a combination of things. So there's some social cohesion within communities, and that's tangible and somewhat measurable. And then there's also that sense of, which we saw a little bit, or quite a lot actually, not a little bit, certainly in the first year of the pandemic response, of communities coming together to support each other and support themselves. And why that's important is because there's always going to be a limit to what we can do as statutory and voluntary services. And the healthiest communities are the ones where they have that sense of cohesion and that sense of community empowerment. And so what we would see is that the communities themselves would look and behave differently from how they do now, whereas we've got lots of pockets of that in Hackney, but we need it on a larger scale if we're going to see communities really thriving. And even you've got some communities that are incredibly cohesive, but they still have you know, high levels of deprivation and a burden of ill health. And what they actually, and that's that point about having connections between communities, as well as the community as a whole, or, you know, community leaders within that group being empowered to be able to, you know, get access to and have influence over power brokers like the council, for instance. I hope that makes sense.
Yeah, there's, thank you. Councillor Turbet-Delof.
Thank you. My question is to just follow up a little bit what Dr. Husbands just mentioned in terms of measurement. It is very ambitious, and as a mental health champion, I'm really pleased to see all the social aspects for mental health. My question is just related to measurement. What is the plan on how to measure, especially, for example, when we read the outreach to people who are not in contact with services? How do we know who is not in contact? What's the plan? You know, it's fair to say that it's also very ambitious and it's new, and maybe we don't have such, you know, long history or precedents or point of references. So it'll be good to hear as well. What's the plan on that? Thank you.
Thank you. So yeah, we don't yet have the plan. It's something that we want to develop, and I think we will be looking. There's some work you could do around sort of predictions, so you could, you know, look, I know that we've done that in terms of cost of living, so we could look at sort of proxy measures to try and understand that, but we don't have a developed plan at the moment, but it is something we're keen to look at and then see if that's something we can measure over time.
Councillor Kennedy, before I bring Councillor Adams.
But a good example of the kind of intervention that you might do to find someone who is isolated is something that they've done in our housing stock, which is where they've looked at everyone who they know lives on their own, who hadn't called in a repair for 2 years, and they've gone and knocked on the door, or they've made some sort of contact just to check that those people are okay. And they've actually found quite a lot of people who'd ended up being very severely isolated, and they found instances of hoarding and people who'd kind of given up on reporting their repairs and were living in very poor conditions. So there are ways of actually working out who is really isolated, and it's not as, you don't have to be as drastic as knocking on every single door. There are certain metrics that you can use that we have that might point you towards people who might need help the most.
Councillor Adams.
Thank you, Chair. Thank you. Thank you for the presentation. We learned that the NHS North London is facing about 30% budget cut.
I've been corrected. I've been corrected by Councillor Kennedy. That's on administrative staff. So, but still, but I think the question's still going to be valid, because essentially there's no uplift for inflation, so there's still immense pressure.
Yeah, just for you know, taking account of inflation, because when you set up your budget and everything, inflation was very low. But looking at the rate of inflation now, how will this affect the programs, or will you be requiring a different funding to sustain the program? And second part of my question is about you talked about the access to low cost of exercise class or free exercise class, because I know when veterinary register was open, I actually wrote a request for concession for anybody over 55 and above, and I was told that it was not viable. So how are you going to make it viable for them to actually get a free or concession for other people?
Thank you for the question. So this work programme isn't funded other than people's time. So what we, as I was saying, we're kind of working off of existing structures. I think where your question is really relevant is in terms of the kind of service provision and how we might see that be affected as we go forward, and also then the impact obviously on mental health and cost of living. But if I understood correctly, if you're asking about this programme being able to go forward, it's really us playing a sort of coordinating role in what's already existing. So that should be able to continue. In terms of your question around low cost exercise classes, so there is an offer for as part of falls prevention for an older cohort, but the places on that are very limited. I'm afraid I don't know anything beyond that, but we can certainly look into that if that's information.
Sorry, Sandra Husbands wants to come on that.
Yeah, thank you. I'm afraid I didn't catch all of the question because the sound quality wasn't great, but just in terms of the impact of the relative, real terms cut in funding, that obviously will affect to some degree the services like befriending or social prescribing potentially. But in terms of the whole programme of work around social connection, it's not only about those individual one-to-one services or even group activities, but it is also about how we find opportunities to support connections between people and that are beneficial and lasting. And that's not necessarily through programs that are only specifically designed for that purpose. So we do a lot of work as a council and as a health and care partnership that brings people together, and we have the opportunity to kind of think about those and not repurpose them as such, but add to that purpose by helping engender connections through them, rather than seeing them as just a delivery of service from a professional group to residents. I hope that makes sense, but I didn't catch the last bit, and I think that I heard Joia say about the exercise classes in terms of falls prevention, but I didn't hear the whole question. So if you want a more specific answer, I'd be happy for us to take that, because I won't have the detail either, to be honest, to take that up outside.
Yeah, I think so. I think we can. Yeah, I mean, I think it was only certain age cohort groups were qualifying for them. I think it was the over 55s, I think 55 and above, and so it was whether there was an argument for or thought had been given to younger age groups qualifying for it on whether it be on a mental health or isolation basis, I suppose. But as you say, let's take on.
Yeah. I'll take that back, and we can provide a proper detailed answer if that's okay.
Thank you. Councillor Patrick.
Yeah, on page 30, you talk about the mental health strategy. It wasn't on the original work streams of the old CCG because it would silo mental health, and instead it needs to, all services need to take it into consideration. But isn't there a danger that doing that, it gets neglected. But I see that we've now got a mental health, you're doing work on mental health, and that you've got a needs assessment and a stream of work. So I just wonder what we're going to learn from that and how we're going to take it forward.
Joia, did you want to?
Sorry. So I think if I understood the question correctly, it was giving enough emphasis to mental health. Is that correct? If I understood the question correctly, is it checking that we are giving enough emphasis to mental health while also considering how we need to integrate it within other services?
We can't hear online, Chair.
Microphone, please, Sharon. You put the microphone.
Yeah, I know, June. Mental health was meant to be taken into consideration by all services to stop it being siloed. I see there's a special piece of work going on with mental health now, and I wonder how you're going to ensure that mental health doesn't get siloed by a specialist piece of work, but also how you're taking forward mental health across the strategy. Sorry.
Thank you. Yeah, I think as came through from the first presentation, mental health in and of itself is such a huge priority that it does require a special consideration, but you're absolutely right, it does need to be integrated across the piece, and I think that's what we're not suggesting that by doing this that this becomes something that's in isolation. I think we're very keen, integrations come up already in this meeting, that this approach includes integration. I don't know if Sandra wants to add anything, but no, the intention is not to make sure that to sort of see mental health in isolation, other than it is a big problem that does need specific solutions. Thank you.
And so just before I wrap this up, in terms of sort of the challenge that Cllr Kennedy sort of threw down earlier about, well, if we just move 1% of funding to prevention, everything we could do. I mean, to what extent is it part of your thinking to evidence locally or pulling on other strands of evidence that it may already be out there in much academic literature, I don't know, to sort of say that if we did that, that would have much more benefits for the system in the longer term, and so as to try and persuade, when your secondary care providers are swallowing up immense resource, there's immense pressures there, but to try and really lever it out, is that something that you're putting together an evidential package for to try and persuade others?
So, I mean, Sandra and I work in public health. I think Chris is on the call too. I think we're all completely passionate about the fact that investing more in prevention and early intervention does reap rewards for the system, and there is a lot of evidence out there on return on investment, particularly in prevention services. I think the evidence is probably that's certainly true, or that is true for mental health. I think it's less clear for these other more social determinants around social connection and financial security. That's not to say I don't think that's true. I'm less aware of the evidence. I think it's a really good challenge that we will take away and look into. Thank you.
In a way, I was thinking more about the social connection aspect. I think, if I remember correctly from a previous presentation by the King's Fund, I think they put that as an equal quarter of people's health outcomes. So yeah, it'll be interesting to see. So thank you for this thought-provoking presentation. I think it'd be interesting at a certain point to maybe come back in terms of when you're more honed on particularly the gaps for the mental health. Bearing in mind, from what we understand, we've got the mental health wellbeing network, or whatever the new phrasing is, coming back to the next month. And I think there was talk there but possibly putting more resource at a higher end was the thinking as I understood it, but we're just trying to understand more details there. But to see whether that sort of marries up with your gap analysis when that's done, and also with you trying to drive through a greater clarity of strategy on the connection element about the sort of the outcome and where that's heading. So this may be something for a year's time or so. But yeah, no, thank you all very much for that. And with that, I will close that item. The last item, everything sort of is very much interlinked on today's agenda. The last item is the cost of living crisis and health equality, and a non-recurrent funding pot of money, which is dealing with a number of different aspects of that. We're joined by Nina Griffith and Jenny Zienau, who's the strategic lead for delivery, who's going to present on it. Nina, thank you for doing this item at short notice and replying to emails whilst on holiday. We're appreciative. So I will hand over to, I think, Nina to start with, and then we'll take it from there.
Thank you, Councillor Hayhurst. We did add this item at short notice, but actually I think it's really important, so we were quite pleased to bring it to this committee. So as you're aware, there's obviously our residents are experiencing extreme pressures with cost of living now, and that is something that where we really wanted to. We realised the benefit of taking a system-wide approach to addressing it in terms of using the collective levers of both health and local authority and voluntary sector partners to think about how we support our residents. So London Borough of Hackney have a poverty reduction framework, which you're probably aware of. From that framework, there are essentially 4 main strands of work. So there's work to think about supporting council services, so minimising the impact and supporting council services. There's work that's thinking about supporting local businesses. There is work that's thinking about supporting council staff. And then there's this strand of work, which I'm going to talk to you about today, which is the work to think about supporting our residents. So we're really thinking about how we support our residents with cost of living pressures. So working together as a kind of partnership within City and Hackney, we've formed a system-wide group to think collectively about how do we address what really is a wicked problem, but how can we work collectively to address our residents, address their kind of short-term crisis needs, but also give them the kind of ongoing support to put them on a more firmer financial footing going forwards as well. So I'm going to give you an update around the kind of 4 areas of work that we've kicked off through this system-wide group to support our residents. So the 4 main areas of work are: 1, trying to coordinate our system response. So that's how we coordinate us as partners across health, the NHS, across the local authority and across the voluntary sector to really think about putting in place a comprehensive response that all of our residents, that targets those people who are most vulnerable and that all of our residents can access. Some of the examples of work in this place have been around mobilising place-based responses, so thinking about what's available in each neighbourhood, mobilising and supporting the implementation of warm hubs, which have been really, really important through the winter and unfortunately continue to be important through what is quite a cold spring so far. We've also, as of the kind of last looking, we've got 23 different warm hubs that are live and registered on the Warm Welcome website that our residents can access. We've also working really closely to work with our voluntary sector partners, both through direct infrastructure grants to voluntary sector partners and through supporting food networks and advice networks to really make sure that voluntary sector are coordinated and working to support our residents. So that's the first area. The second area is what we're calling equipping our frontline staff. And this is really giving the tools and skills to all of our frontline staff who work in health, local authority and the voluntary sector to provide to identify when they see people who may be in financial hardship, to provide advice, support and signposting to those people, and also in some instances to be able to give direct aid to those people as well. So we've mobilised a direct referral route from 32 different services so that services can directly enable their clients to access up to £200 of household support funding to support with food and fuel. We've also been able to channel money through a number of voluntary sector partners so that they can also directly help residents with food and fuel as well, and directly give aid to residents directly. And a big part of that kind of equipping frontline staff is kind of a bit of an OD challenge, an organisational development challenge, around really supporting and enabling our staff to be able to think about making every contact count in relation to identifying and supporting people presenting with financial hardship. The third area is what we're calling income maximisation, and this is primarily through the Money Hub. So I'm sure most of the councillors are aware that in November 2022, the local authority launched a Money Hub that was intended to be a single point of access for residents experiencing financial hardship, and also to provide outreach, targeted support to more vulnerable residents and those at risk of financial hardship. And the Money Hub provides advice, support and to people, and will also directly enable individuals to access all of the either crisis funding or ongoing benefits that are available to them. In the first 4 months of the Money Hub's operation, they've been able to give out an additional £240,000 in one-off grants to our residents. And they've also been able to put in place £248,000 of ongoing sustainable income into households. And that's really positive. And they've got a target of increasing the income, reaching our residents by £1 million over 12 months. So that's the kind of target that they're working to and are still on target to meet, which is really, really, really impressive and really important. And then the fourth area that we are looking at through the system-wide group is what we're calling the kind of data and insight stream. And this is being directly led by the Population Health Hub you just heard from. And that's about really making sure that we are hearing from residents, frontline staff, and triangulating that with the data in terms of what is it that our residents are struggling with, where are the challenges, which groups are most challenged, and getting some quite qualitative data about how those challenges are presenting and what we can do to resolve them as well. And that's an ongoing process through the programme that we will continue to kind of utilise and learn from. So that's a kind of very quick summary of what we're doing in the four main areas of work. I think I'll probably leave it there and hopefully open it up to questions. And Jenny's here as well to help answer the questions too.
Thanks, Neil. Great to hear about that all, and particularly about the success of the Money Hub. Just in terms of sort of the nuts and bolts as to how it works then, in terms of referral pathways on the Money Hub, so what the residents can go to what certain drop-in sessions, or do they have to make an appointment? How much money can they access once they've accessed it once? Can they not access it again? Is there sort of a condition on them accessing it that they get some help in terms of reviewing to make sure they're claiming all the benefits they're entitled to? Just those nuts and bolts. Can you just talk us through a bit more on that side, or Jenny?
So there's a self-referral, so residents can refer themselves to the Money Hub, either online via telephone. There's a bit of a vetting process to make sure that the right people are accessing the service. And then once they access the service, I think the type of support that they get varies depending on their needs. So we've heard examples of people having one-off conversations to support them to say, you're eligible for this benefit, which you're not getting. Here, we'll help you get this benefit. That's great. There's also more commonly that they are worked with over a number of conversations to really think about what their kind of ongoing needs are and to support them to get to a better footing. For example, making arrangements around rent arrears and coming to a kind of agreed settlement around rent arrears, but also at the same time making sure that there's a sustainable and achievable payment plan for that resident so that they can over time get to a more sure setting with rent arrears. So I think it's quite bespoke depending on the needs of the individual. The team also have different people in the team with different expertise. So they have people who are experts in housing benefits. They were recruiting and may now have recruited someone who is expert in disability allowances. And they've got people who know about different types of benefits so they can provide more bespoke services, bespoke advice and support, and sometimes case management as well. And then the other part of the Money Hub is the outreach element. So actually targeting individuals that they think are at risk of falling into poverty. Jenny, I don't know if you wanted to expand on that.
Yeah, thank you, Nina. So in terms of the outreach, that's very much a partnership between the voluntary and community sector partners who are community-based, who have the direct trusted relationships with the residents that they're worried about and have identified as being those that might benefit from an outreach approach. So an example of that is Lubavitch Children's Centre in the Stamford Hill area that have had a number of outreach sessions developed in partnership. So those that are working within the community are able to book those appointments. So each of those kind of outreach sessions are kind of co-designed really between the Money Hub and that community partner, depending on the needs of the community and those that are arising. So that could be a one-off appointment, and much as Nina describes, is very much bespoke. I think in some cases there have even been some home visits where there have been particular challenges. So there is some flexibility in the approach in terms of the outreach, both from the Money Hub itself, appointments within the Hackney Service Centre or in the community, or in some cases, in some exceptional cases, some home visits where there've been, somebody's been able to kind of support that resident with papers that they wouldn't have otherwise been able to work through on their own.
Thank you. Cllr Adebayo?
Thank you so much, Jenny, and thank you, Dr. Nina. Firstly, I just want to say, appreciate the wonderful job that you are doing, and at the same time, I'm wondering if there is any barrier in accessing your service, especially the outreach service in the community. I'm talking in terms of those who has no recourse to public fund.
Say the last bit again, sorry, Councillor.
Okay, is that a barrier to those who can access your outreach service? And that includes those who have no access to public fund?
Yeah, so I think that's a really good point. So the first thing I would say is we've tried to not introduce any barriers. So we're trying to support everyone who comes forward. We acknowledge that everyone has different levels of, everyone has different levels of trust in the local authority and in statutory services. So we recognise that not everyone will come forward to come to the local authority to say, we need help, which is part of the reason why we've got the outreach and why we've channeled some of that outreach work through the voluntary sector, because we know that many voluntary sector partners often have better, trusting relationships with our communities than we do in the local authority. And I think we've had to really acknowledge that in this work. In terms of people with no recourse to public funds, that is a challenge, in the sense that what we can't do is, what the Money Hub cannot do is just, give out. What the Money Hub is doing is supporting people to access all of the benefits that are available to them within the context of a policy framework and a fiscal framework. So they can absolutely support people and there's lots of opportunities. We know there's lots of opportunities to do that. We know that people in Hackney are not accessing all of the benefits that are available to them, but we also know that there are people who won't necessarily have access to those benefits, and that is a challenge. And we can help them find support through kind of more traditional, through kind of homeless services, and through charitable ventures, but it is more limited. I think that's a population that are more limited in how much we can sort of increase their income.
Thank you.
It's a very good point, Jenny.
Jenny?
We are in the process of setting up a hardship fund for people with no recourse to public funds that's taken slightly using some of the funding from the North London Waste Authority windfall that came into the local authority. So that's who are working on that in partnership with a delivery partner in the voluntary and community sector. So we are hoping to go live with that within a few weeks, although we haven't got a confirmed date on that because there's a few things that need to be put in place. But we're really aware that it's a barrier, and it's a significant concern for many in our voluntary and community sector who we're in regular contact with regarding the food support on offer. So as Nina said, that's all the more important that we're working with partners, and we hear through our fortnightly session tools for frontline practitioners working with residents who are struggling. We hear from partners on the ground who are problem solving together around particularly those that are struggling to access the Money Hub or other resources in the community. So we see that as a really important part of the work, keeping in touch with community partners in that way, so that they can use their trusted relationships to have those conversations and support those residents with those barriers.
Councillor Kennedy?
It was Jenny's mention of the tools for partners that just made me stick my hand up, because I really want to emphasise to everyone on the call that there is an amazing fortnightly catch-up on how it's working, how you access the system, all parts of the system. So all of those 4 strands that Nina talked about. There are officers on the call who will hear from different organisations each fortnight, but at the same time, just say if there's anyone new here, we'll talk you through the system. Please ask us your questions, and it's open to all partner organisations right across the system. I would recommend actually that all members of your commission chair listen in just once to understand what's going on, because it's an extraordinary resource. And I've heard many organisations say, wow, that is just great. I mean, it's a really example of good practice of sharing what's out there and being completely open to all questions as well, because people can work out how to raise certain bits of casework and stuff like that. I think a fabulous resource.
I saw Cllr Turbet-Delof first, then I'll come to Cllr. Sharon's got Cllr Turbet-Delof first, and then I'll come to you. Claudia's first, and then.
Thank you, Chair. I have just to add on just a quick comment and contribution regarding residents with no access to public funds, no recourse to public funds. Especially since the cost of living crisis, the home office costs are extremely high, and given the current financial crisis, people are also finding it difficult to go through those migration status processes. So it's really worth bearing that in mind. That also affects and makes it almost impossible to access those visas, or they are pending processes. Just a very quick question on. It's really great to see the levels of grants being accessed. We often hear the residents that say that they don't always know. And I can see here that there is a £28 million a year worth of benefit income unclaimed by Hackney residents. My question is, within the under 3.3, how much of these grants are being utilized? Are they utilized in full or underutilized? Do we have data on that? Because this is the numbers of what has been used and provided to residents, but do we know if these grants are being used in full? Thank you.
Are you okay to answer that, Nina, there? So it was an observation, I think, more on the no recourse public fund, but in terms of the grants aspects, are we using the full capacity of the pot that we've got? Is it being staged over the period we've got it, or is there still capacity and there's more grant possibly available than's being claimed or given out?
The sound's not brilliant. Which is there? Which of the grants? There's a number of different grants. Are you talking about grants going to voluntary sector, or are we talking about specific grants that residents can access directly?
Thank you. What I'm trying to say, perhaps maybe I didn't convey it well. So it seems that Hackney residents are not claiming, are under claiming. So that seems to be a statistic within the borough. So does that correlate to how people are accessing grants? Is the same happening within the grants that you mentioned in 3.3? Are people utilizing all of the grants? Are they accessing them? Or the numbers that you're giving us, what percentage of those grants are these? I don't think I'm explaining myself well. What I'm trying to find out is whether we're utilizing all of the grants that are being given at full capacity or not, or if not.
Yeah, so one of the kind of rationales for having the Money Hub was that we can see that there are significant benefits, including grant, through a combination of things, whether that's grants or kind of ongoing benefits that we know Hackney residents are not taking up. So we know that our Hackney residents are not accessing all of the money that is available to them to support them. And that was the kind of rationale and the case for change for having the Money Hub. I can get you the full value of that. I don't have that to hand, but I can get you the full value of that. I want to say 15 million, but I would need to double check that over a year period. The money that we've described in section 3.3, so 28 million, it is in the paper, so 28 million pounds of benefits was not taken up. The money that we've described in 3.3 is money that has gone to households. So that is money and grants, benefits, cash that has gone to households as a direct result of an interaction and an intervention from the Money Hub.
So I think we've got it. So basically, we estimate that around £28 million of benefits is going unclaimed in Hackney a year.
Yeah,
so far, the Money Hub has hopefully got roughly around 500,000 with a target of getting to 1 million. So that's for a year's project. So what will be a year's project? That's a very well achieved sizable dent in that. But also what we see is the reference for the one-off grants. That is different. That is an isolated pot for grants. That's different from helping people claim benefits. Is that right?
Yeah. So the Money Hub can help people either. There's a number of different financial aids that are available to people. Some of them is one-off grants for things like food and fuel and people in crisis. Some of it is just ongoing uptake of benefits. So we've differentiated in terms of they've supported an additional £240,000 of one-off grants, but then they've supported £248,000 of ongoing recurrent benefits.
Thank you. Councillor Patrick.
Chair. I just wondered how the Money Hub or how the system is reaching out to residents in the private sector. It's perhaps easier for residents in social housing to access the service or find out about it, and more difficult for those perhaps living in the private sector to find out about the service and access it. And if I was being cheeky, I wanted to know about the warm spaces hubs and how they're working. I've been curious about this for a while now, and it's your fault.
Yeah, so certainly the Money Hub is absolutely available for people in the private rented sector. And we know that I've heard lots of case studies of people that they have helped in the private rental sector. So that is absolutely, and you know, that is a cohort of people who can absolutely access help from the Money Hub, and they will be specifically outreaching to certain individuals based on whether those individuals are deemed to be vulnerable, but not specifically because they are in the private rented sector. But we can definitely think about how to promote the service to people in the private rented sector for sure. In terms of feedback from the warm hubs, I don't have any specific feedback. I don't know if, Jenny, you've had any feedback from our partners providing warm hubs.
Yes, thanks, Nina. So actually, Claire and Krista, who we heard from earlier, are two of our warm hub recipients. I've heard really fantastic things about the work that they're doing. I think I heard a quote via a colleague that Krista and Claire are putting the community back into community at the warm hub that they are running, that was the recipient of some funding from the community resident participation team. I think it's been it has been a really valuable, I'm sure, you know, some more successful than others, but I think where they've been most successful have been where community partners are really providing spaces that are well utilised anyway within the community, and where they've been able to extend the hours of that provision and offer a range of useful resources and supports within them. So I think, you know, whether it's homework activities for children and young people, or board games, or and hot meals. I know one of our community partners bought a washing machine so that residents can come and do their washing within the warm space, because the housing association was paying for the gas and electric anyway, so they use their grant, and it's been helpful that they can use that quite flexibly. So when people come in to do their washing, they're also making connections with others in the community. So I think they've been a really, you know, I suppose speaking to the previous item on the health and wellbeing strategy work as well, you know, I think there's a lot of learning there, and there is some work ongoing, and I think that Healthwatch are going to be maybe helping us to do some of the kind of insight gathering toward the end of the warm hub piece of work. But I think it's been a success because the community partners have made it a success, and it's been spaces that you know, have been really well thought about within our communities, and our two system conveners who are funded by the poverty reduction investment from London Borough of Hackney, have been out there on the ground visiting all the warm spaces, finding out what the residents who are attending need and what other outreach might be most useful to have in those spaces. And that's really made a huge difference in being able to make those local connections and build those relationships with local social prescribers, for example, but based on the needs of those that are coming into those spaces. So I think there's a lot of learning there that we're reflecting on now, and thinking in terms of how we build on that in the work of kind of prevention, and you know, as has been mentioned by Councillor Kennedy and others, in terms of its importance in kind of further enhancing the sort of safety net of support for residents across the borough.
I think Councillor Patrick wanted to come back.
Come back on the private sector housing. I know there's data protection, but I wonder whether you could somehow use, not this is the name, but the information that the private sector housing team has, in the sense of perhaps accessing people that live in HMOs, because obviously if you live in a house in multiple occupations, it probably means that you've not got a lot of money, since you can only afford to rent one room and share communal spaces. So they may be people that you can somehow reach out to, and also through the licensing scheme in the north of the borough. I know from wandering around the borough, knocking on doors, that there's lots of houses in Cllr from Brownswood that seem to be divided up into very small properties. Maybe the people who live there don't have any money worries, but you know, the smaller the property that you rent, the more likely that you are to perhaps be in money worries. I do think we need to go out there and somehow make sure that people who do live in the private sector know about the service. I'm not saying we're not helping people that come from the private sector, but I think we need to somehow get the information out there, because, you know, as you're a council tenant, you get all sorts of newsletters from the council and notice boards and information Whereas I think if you live in the private sector, lots of people in the private sector are working very long hours, and perhaps don't have the access to such information. They're often working one, maybe two jobs out of long social hours. So we need to think about how we're going to access those people and make sure they know about the sport that's there.
Nina or Jenny, do you have any observations?
I think that's a really good point, and I think we should take that on board. And I think the kind of inequity in access to information between people in housing associations or council properties, I think is a very well made point that we need to take back. So thank you for that.
I've got Sally from Healthwatch, who's had a hand up for a while. Sally.
Thank you. Yeah, just picking up the point that Jenny was making. We spoke about this a little bit the other day. Healthwatch did a little bit of work around engaging around cost of living just before Christmas, and it was quite a qualitative piece of work. So we spoke to under 100 people, but in quite a lot of detail. We were thinking about, is now the time to kind of revisit that work. Listening to what's been said, I'm thinking we can do it as a more of a quantitative approach. We've recently done a bit of work to kind of unblock our approach to surveys, really. So for instance, this week we've put a survey out and got a response from nearly 2,000 people responding in 4 days. So I feel like that's an avenue we can use to reach out. And I was thinking in terms of finding out, are people accessing services like the Money Hub, what's working, but also thinking about what we said earlier about making sure there's funding in the future to carry on things that are really working well. This could be a good point for us to survey enough people to hopefully get that evidence base back for you guys services to say, look, this many people are saying we've linked in, we've used the warm hubs, we've used the Money Hub, it's really helped, and just helping make sure that these things kind of stay there in the future. So we can have a think about what we need to ask and how we need to phrase those questions with you guys if it's helpful.
Thanks, Anna. I think, yes, I mean, that may be a conversation you take offline with Jenny and Nina about how it can be best utilised for, and maybe even dovetailing Councillor Patrick's point about the private rented sector and their access or not, or whether there could be greater access there. So thanks for that. But second round of questions. I first saw Cllr Adebayo. Did you want to ask another question? Your hand's gone down.
I think it has been asked, so I just let it go.
Thank you. Thanks, Greg. Thank you. And then Cllr Turbet-Delof.
Thank you, Chair. Very briefly, this is related to the Free School Meals Task Group and Summit that's been mentioned in page 97. Just wanted to check timelines for when the report will be published. Thank you.
I would need to go and confirm that, actually, to get you I don't want to make a commitment to a time frame, so I'm not completely sure, but I'll take that away and we will get that to you.
And Councillor Adams, do you have a follow-up question?
It's a quick one. I know that from the booklet that the funding is going to run out in October. So what is the plan going forward when it runs out in October?
And that was my final question as well.
Yeah, no, we're very aware and very conscious that a number of these initiatives are funded via non-recurrent funding routes. So I think the onus is on us to firstly really maximise the benefit for these things while we have them, but also really make sure we maximise, understand, do a proper evaluation and get full learning, and then use that evaluation to really think about what is needed in the future. Part of what we want to understand through the Money Hub is where there's already been a point of failure. So part of what we're seeing is, in some instances, there have been points of failure that have led to people needing a service like the Money Hub. So what we'd really want to do is make sure that we get things right first time. We think about that learning. We kind of think about that learning in terms of what our sustainable offer is going forward. So it might look different. We're not sure. We're also aware that part of what we've done in response to cost of living is mobilised a lot of services, offers that support people with kind of economic problems, And so we really want to try and look in the round at what has worked, what hasn't worked, to really make sure we have the best and most cost-effective but most effective offer going forwards. So I think this period is about maximising the benefit, but also maximising the learning, and then thinking about that learning in terms of what we put in place going forward, acknowledging that there are challenges on all budgets.
What was the budget going in for the money having to be set up? I mean, how much of the council, how much of it, it's an IC, but it's a joint council and in-L funding stream. How much was it?
Yeah, so the local authority pulled together existing teams. So they pulled together some existing teams and to put in place the Money Hub as a single point of access. And then Health and Care Partners put in place an additional £509,000 in order to expand and enhance those teams and create the Money Hub. And that £509,000 came from some non-recurrent transformation monies that were available, and from underspends on previous health funding that the Health and Care Board hold.
I mean, one prism maybe to look at it is, I mean, obviously there's the grant side and there's the connection side, which is very, not to undervalue that. But if at the end of the year you are still helping people get unclaimed benefits at the same rate, so you're still, if you're going to get £1 million a year, but if you're still achieving that at the end, I mean, and that can carry on. I mean, until that tapers off, because that dovetails very squarely with the third strand of the health and wellbeing strategy in terms of supporting greater financial security. I mean, that in of itself is a very firm evidence base that is worth the resource, I would have thought. And I can appreciate if that then tapers off dramatically, you can then sort of question that on that line alone. But surely there's got to be a strong argument that if we're still retaining that this should be continuing, I would have thought. But yeah, okay. And then I'm not going to say any further questions because it's going to encourage a further round. We've only got 4 minutes left. So with that, I'm going to close this item. Thank you very much. That's been really fascinating to hear about all the great work on that. And then I think, yes, I mean, I don't think it necessarily needs to be an item, but I think at the point that just to understand what is then happening to it, Nina, the point that the funding cycle is up, what is the plan going forward at the relevant point. So with that, then I'll close that item. Thank you. In terms of other items on the agenda, minutes of the previous meeting, can I take those agreed, please, members? Agreed. Thank you. Work programme is at the back of the agenda. And I haven't been notified of any other business, and so with that I'll close the meeting and thank you to everybody. Thank you.